Welcome back, everyone, for another healthcare deep dive. We love getting your news articles, so let's just jump right in and see what's got everyone talking today.
Well, we can't ignore the elephant in the room, with all this back and forth from the White House.
Yeah, the funding freeze that KFF Health News reported on that's affecting Medicaid grants, loans, all kinds of things.
It really threw everyone for a loop. States were saying they were being shut out of Medicaid payment portals, and of course that creates immediate problems for providers and patients.
I can imagine. What happens if this funding freeze actually goes through, even if it's just temporary?
Well, they pulled back the memo, but the administration still says they want to freeze the funding, so it's a real standoff. Could delay payments disrupt services, create a lot of uncertainty for millions of people?
Definitely a nail-biter, for sure. Okay, well, let's move on to Robert F. Kennedy Jr. His confirmation hearings for Health and Human Services Secretary were today. His views on vaccines have really been making waves.
Definitely a hot topic. And, it's interesting to see this happening at the same time. We're seeing that resurgence in raw milk advocacy.
And during the hearings, there was a moment where he seemed confused about how Medicaid and Medicare are funded.
Yeah, and that's a bit worrying. These are cornerstones of the U.S. healthcare system. So to see that lack of clarity raises questions about his ability to lead the agency. Plus, you have all of those doctors criticizing his stance on vaccines. So, yeah, a lot of uncertainty surrounding him.
Could be a big shakeup, depending on how things go. All right, let's switch gears a bit and talk about AI. It's been all over the news lately.
Yeah, DeepSeek, that Chinese startup, they're saying their AI model is just as good as the American ones, but way cheaper, and it's shaken up the market.
You're right about that NVIDIA's stock took a hit and other companies are scrambling to respond. What are people like Zuckerberg and Nadella saying about all this?
Well, Zuckerberg seems to be doubling down on AI investment, but Nadella is actually pretty optimistic about DeepSeek. He sees them entering the market as a good thing for the industry as a whole.
Makes you think about how AI is going to affect costs in healthcare in the long run. Now, speaking of AI agents are supposed to be a big trend in 2025.
It's all about action. Think super advanced digital assistants that can work with all sorts of systems and complete tasks on their own.
Wow, what would those AI agents be doing in healthcare?
Oh, tons of things. Scheduling appointments, reminding people to take their medications, even giving basic health advice based on a patient's data.
Sounds like it could change how we interact with the system entirely. While we're on the subject of AI, the U.S. Copyright Office just made a statement about copywriting AI-generated content.
Yeah, they said it's only eligible for copyright if there's been significant human contribution, which opens a whole can of worms because how do you even measure that when AI is becoming more and more creative?
Feels like we're just starting to figure out the legal side of all this as AI gets more integrated into our lives. Okay, let's move on to digital health trends. What's catching your eye?
Well, telehealth is exploding right now. Companies are adding more and more services, and their marketing budgets are through the roof, trying to grab as much of the market as they can.
No surprise there, especially with how much people relied on it during the pandemic.
Right.
What about other digital health developments?
Hospitals are getting creative with how they're using AI, like McLaren Healthcare. They've got a ChatGPT-style tool to help their doctors keep up with the latest medical knowledge.
Smart thinking, especially with how much medical information is constantly being updated. But is there a risk of relying on AI too much when making medical decisions?
Oh, absolutely. AI is powerful and can definitely enhance decision-making, but it's still just a tool. Human judgment and expertise are still crucial to providing good patient care.
It's all about finding the right balance then.
Yeah.
Now, on a different note, Cone Health is investing in AI to help prevent radiologist burnout.
Radiologists have incredibly demanding jobs with heavy workloads and constant attention to detail, so it makes sense that Cone Health is looking at how AI can reduce some of that pressure.
This brings us to something that's always on people's minds, healthcare costs. A lot of people are saying that site neutrality payment policy is the way to go.
It's all about making things fair so that healthcare services cost the same, whether they're provided in a hospital outpatient department or an independent doctor's office.
Sounds logical. So is anyone pushing back on that idea?
Actually, Richard Fogel, who's the chief health outcomes officer at Ascension, he says that site neutrality just doesn't address the real root causes of high healthcare costs.
So what does he think is driving up those costs then?
He points to a few things: the complexity of administrative processes, the fact that prices vary for the same procedure depending on the provider, and a general lack of transparency when it comes to pricing. He says those are the big culprits in the U.S.
He seems to be arguing for a more systemic solution instead of just shifting payments around. What does he think needs to happen?
Well, he's a big advocate for price transparency, and he wants to see those administrative processes streamlined. And he thinks we should be moving toward value-based care, where the focus is on how well the patient does not, just how many services they get.
Big changes for sure. Do you think people in the healthcare world are actually listening to these ideas?
I think there's a growing awareness that we need to look beyond just treating diseases and start focusing more on the things that actually influence health outcomes.
Yeah,
Things like social determinants of health.
that's a term you hear a lot these days.
Yeah.
What exactly does that mean?
It's basically all the things outside of healthcare that can impact someone's health, like their education, their economic situation, even the physical environment they live in.
So it's acknowledging that health is about way more than just going to the doctor.
Exactly. And we're seeing a real push to incorporate these factors into how we deliver healthcare, like connecting patients with food assistance programs or transportation or job training, all right there in the healthcare setting.
So a more holistic approach. Are there any areas where this is really making a difference?
Brain health is a great example. Researchers are finding more and more links between social factors and cognitive decline. Things like social isolation, chronic stress, limited access to education. Those can all increase the risk of developing dementia later in life.
Wow, so changing those social conditions could actually protect people's brains. Are there programs that are specifically trying to do that?
There are. Some community organizations are doing great work. They're creating programs that encourage social interaction and offer educational opportunities, and they're really tailoring them to the specific needs of different communities. It's all about creating environments that support brain health throughout a person's entire life.
It's really encouraging to see that happening. It feels like the definition of healthcare is broadening to include all these different aspects of a person's life.
I think that's a really good way to put it. We're moving beyond just the absence of disease and recognizing that true well-being includes mental, emotional, and social well-being, too.
Absolutely. And speaking of well-being, we can't forget about the people working in healthcare. Physician burnout is still a huge problem, and it seems like AI is being touted as a potential solution there, too.
Well, Cone Health, using AI to help with radiologist workload, is definitely a positive step. But we have to remember that technology can't fix everything. The system itself needs to change. We need to reduce administrative burdens, make sure work hours are reasonable, and provide better support systems for healthcare professionals.
It sounds like a multifaceted problem that needs a multifaceted solution. What else are people doing to support healthcare workers?
Hospitals are starting to implement well-being programs that focus on mindfulness, stress reduction, and peer support groups. The idea is to give healthcare workers the tools they need to handle the emotional and psychological demands of their jobs.
That's so important, not just for the workers themselves, but for the quality of care they're able to provide.
Right, when doctors and nurses are burnt out and overwhelmed, it affects everything. It can lead to mistakes, and ultimately it just drives up healthcare costs even more.
So investing in their well-being is really an investment in the entire system. Now let's talk about some specific treatments and medications that are in the news. The GLP-1 drugs like Ozempic and Wegovy, they were originally for diabetes, but now they're being used for weight loss.
Yeah, and they've shown some really promising results in clinical trials, but there have been reports of side effects too, like gastrointestinal issues, and some people are saying they're experiencing urinary incontinence, especially with Ozempic.
That's a good reminder that every treatment has potential risks and benefits, and patients need to be aware of those.
Absolutely. It's so important for patients and their doctors to have open and honest conversations about those risks and benefits so they can make the best decisions together.
Shared decision-making at its best. Now, another trend we're seeing is the increasing demand for patient engagement solutions.
Definitely. Patients want to be more involved in managing their own health, and there are more tools than ever to help them do that. Telehealth platforms, wearable devices that track vital signs, all sorts of things.
It seems like patients are becoming more proactive about their health. Why do you think that is?
Well, the internet has given people access to a ton of information. They can research their symptoms, compare treatment options, connect with others who have similar conditions. It's empowering them to ask better questions and advocate for themselves.
Technology is definitely playing a big role in that. But it's also important for doctors to be open to that kind of patient engagement.
Absolutely. Open communication, trust, and mutual respect, those are the foundations of a good patient-provider relationship. It's about working together as a team to create a treatment plan that's tailored to the patient's individual needs and goals.
It's amazing to see how much things have shifted toward patient empowerment. So as we head into the final part of our deep dive, what are your main takeaways from all this healthcare news?
Well, it seems like we're seeing a lot of different trends converging all at the same time.
What do you mean by converging?
It's interesting how all these seemingly separate things like funding debates, AI advancements, and this push for patient engagement are actually all connected in a way. They're all kind of pushing healthcare toward a tipping point, where those traditional models are being challenged and we're starting to see these new approaches emerge.
So we're on the verge of some major changes.
Exactly. And it's being driven by this whole mix of factors from technology to shifting expectations in society.
Exciting, but also a little daunting.
Definitely. There's so much potential for positive change, though. Think about a future where healthcare is more personalized, accessible, and affordable because of AI, and a bigger focus on preventative care.
Now, that's a future I want to see.
Yeah.
But as we move forward, what are some potential roadblocks we should be watching out for?
Well, we need to make sure that all this new technology is being used responsibly and ethically.
In what way?
We need to be asking the tough questions, like how do we make sure AI algorithms aren't biased and don't just make existing health disparities worse? And how do we protect patient privacy when all this data is being shared and analyzed?
Those are some big questions for sure.
Yeah.
We need to balance innovation with protecting people from unintended consequences.
Yeah, absolutely. And we can't forget about the workforce challenges either. Things like physician burnout
Yeah.
and the shortage of healthcare professionals.
Right, those are huge issues.
Mm.
What can be done about that?
We have to create a better work environment for people in healthcare.
Yeah.
If we don't, we're going to keep seeing those shortages and it's going to impact the quality of care.
So investing in the workforce is crucial. Now, what about the debate over healthcare costs?
Yeah, that's a tough one. Richard Fogel's argument against site neutrality payment policy really highlights how we need to tackle the systemic reasons why healthcare is so expensive in the first place.
He seems to want a more comprehensive approach to bringing costs down.
Right. He wants more price transparency, streamlined administration, and a shift to value-based care.
Big changes that would take a lot of cooperation from everyone involved.
Definitely. It's a conversation that needs to involve policymakers, providers, payers, patients, everyone, really.
It's good to see that conversation happening, though. It shows people are ready for something to change.
Yeah, and that they're open to new ideas. The future of healthcare is full of uncertainty, but it's also full of potential.
I like that. So as we wrap up our deep dive today, what's your final message for our listeners?
Stay engaged, stay informed, and stay curious. Healthcare is constantly changing, and we all have a part to play in shaping what it looks like in the future.
Great advice. Thanks for joining us on this deep dive into healthcare news. Until next time, stay healthy and keep exploring.